Welcome back, everyone. Well, it can be a difficult diagnosis for a child to deal with. Today, we're learning more about lazy eye, its causes, symptoms, and even treatment options. I'm joined now by Dr. Farrah Sunderji with Eyedeology at Centennial Clinic. Thanks so much for joining us this morning.
Oh, you're welcome.
It's good to have you back. I know you've come on the show before with some really helpful advice and some tips. And today, we're talking about lazy eye. So what exactly is it?
So lazy eye or amblyopia is the leading cause of vision reduction in children. It affects roughly 2 to 3% of the population. It develops when the nerve pathway between the eye and the brain is not stimulated correctly. So the eye then tends to favor the eye that sees clearer, and it suppresses the other eye.
Okay.
When the brain suppresses that eye, clear vision does not have a chance to develop, and the eyes are not being used together effectively, and there's a reduction in depth perception or 3D vision.
Oh, that doesn't sound like fun. So then what causes it?
So there are 3 main causes of lazy eye. The most common is a strabismus, which is also known as an eye turn or a wandering eye, in which there's a misalignment of the muscles. So one of the eyes is pointed in, out, up, and or down. The most severe cause of amblyopia is deprivation, in which there's an obstruction that deprives vision in that eye. An example of this would be a cataract, which is a clouding of the lens in the eye. An opacity, droopy eyelid can cause that. The third cause is refractive. So that's when there's a significant difference between the 2 eyes in the amount of farsightedness, nearsightedness, and or astigmatism, causing the eyes not to work together effectively.
Would you say this is common? Is this rare? And we're talking about children, so is this common in children?
So roughly 2 to 3% of the population. We advise parents to monitor their children and make sure that their eyes are working well together, that they're coordinated, so there's no misalignment of the eye, they're tracking well, and there's no reduction of depth perception.
Okay, and then as far as treatment options, if you do see these signs in your child, what are the treatment options?
So if your optometrist diagnoses your child to have a lazy eye, there are several treatment options, and they can be used in combination. So we can prescribe eyeglasses and or contact lenses, do eye patching where we stimulate the vision in the eye that doesn't see well. Eye drops can be used for the similar purpose. We can also do vision therapy or eye exercises to train the focusing system, eye tracking, and eye coordination. In certain cases, eye surgery is needed to correct a misaligned eye, remove a cataract or a droopy eyelid.
Okay, and early detection is key with this?
So lazy eye, early detection is the key, and that's done through early eye examinations. So we advise parents to bring in their children as early as 6 months of age for their first eye exam, and thereafter annually. Alberta Healthcare covers annual eye examinations for children under the ages of 18 years with their optometrist.
So a good idea to bring them in for sure. Seems young, 6 months, but like you said, it's covered and you can detect, you know, these kinds of things early and get it treated soon. Thank you so much, Farrah, for coming in. Really appreciate it. Great advice.
Thank you.
You can get more information at www.eyedeology.ca. We also have a link on our website, globalnews.ca/Calgary. And also don't forget to pick up the latest edition of Calgary's Child magazine. It's on stands at various places in Calgary. You can also like them on Facebook and you can follow them on Twitter.